mentioned going to the toilet regularly. Well, why is that important? Well, it's because being constipated is another way of being overexposed to estrogen. And this is because the body discards excess hormones and products of metabolism through our feces. And when we get bunged up, those waste products seep back into our bodies through the intestinal wall and they get remetabolized. And this actually increases our hormonal exposure. So in helping us to make large and soft stools, a high fiber diet can be really, really useful for hormonal regulation. And lastly, I'd like to touch on pollutants for this part of the presentation. Things like plastics and insecticides can have hormone mimicking effects, and they've been linked to breast and prostate cancer. And in fact, as an example, many studies on phthalates, which are chemicals used to help the durability and flexibility of plastics, show that they can disrupt our hormones. And they've also been linked to developmental issues, fertility problems, obesity. And one study shows us a mechanism by which phthalates induce proliferation and invasiveness of even estrogen receptor negative breast cancers, as well as those of hormone-dependent breast cancers. But it's not just women. Unfortunately, studies have shown that reduced sperm counts, missing testes at birth, which is known as cryptorchidism, testicular tumours, and a problem called hypospadias, which is where the opening of the urethra on the underside of the penis occurs. These have all been potentially associated with phthalate exposures. And the unfortunate thing is that we are exposed to these chemicals without even realizing it, often through all sorts of things. And that list can include things like certain perfumes and makeups, shiny till receipts, microwave meal wrappers and containers, drinks bottles, plastic drinks bottles, deodorants, creams, nail polishes. So there's all sorts of things. And without trying to alarm you, I just think it's important to have some awareness of that, because that really is the first step in noticing how our bodies are affected by our environment. And I recognize that it can feel a bit overwhelming if we think about it a lot, but the great thing is that when awareness can lead to action, we can gradually begin to minimize these exposures from our lives. And it can start small. So if you're somebody that regularly microwaves your food, think about putting your food in ceramic or glass containers first. If you're somebody that drinks a lot of water from plastic bottles, then think about maybe investing in a water filter, or when you're going out for a picnic, make sure that you have a glass bottle so that the water doesn't heat up in plastic and cause you to have higher microplastic exposures. These are hopefully small, easy wins that will reduce your long-term exposures and improve your long-term hormone health. So now I'm going to move on to talk a little bit about the monthly cycle, because although every woman will go through periods, we don't always necessarily know what's going on with our periods. So it's quite handy to have a basic understanding of this. So put simply, our estrogen levels are at our lowest just before and during our monthly period, which you can see here on the graph. The ovaries then release estrogen to reach a peak about 2 weeks later, which stimulates ovulation, which you can see again from the graph. Then the estrogen dips a little and gradually rises again to thicken up the endometrial lining, ready for a pregnancy. But then if the egg is not fertilized, the estrogen then falls rapidly, and then the thickened lining of the womb is lost in the monthly period blood. So you can see there that the cycle every month is split both into the follicular phase, which is the first 2 weeks, and the luteal phase, which is the second 2 weeks. Now, as that womb lining breaks down, prostaglandins are produced by the endometrial cells, which are the cells that line the womb on the inside. And this causes constriction of the blood vessels and contraction of the womb, which actually causes pain and at times increased bleeding if you have too much of these prostaglandins. They can also cause nausea and vomiting and even diarrhea as they enter the bloodstream and affect the woman who's having a period. Now, Period pains shouldn't be underestimated. I remember myself as a teenager really struggling with period pains. And I recently read that actually period pains can even be more painful than a heart attack for some women, based on the levels of prostaglandins in the bloodstream. So just be aware that, if a man and you're watching this and you hadn't realized, period pains can be particularly problematic. And what do we do if our hormones are out of sync? Well, if there's too much estrogen, then the womb lining builds up more than it should. And if there are too many prostaglandins, as I mentioned, then the womb lining is thick, and also the cramping and the pain is worse. Interestingly, that's actually why oral contraceptives help with period pains, because they inhibit prostaglandins by inhibiting the growth of these womb lining cells. Anti-inflammatory painkillers can be helpful as well by, again, reducing the production, this time, of prostaglandins. But this is also where food can help us as well, because by eating foods rich in whole grains and fiber, fruits and veggies and legumes, we reduce the amount of excess estrogen cycling within our bodies. And also, hopefully, we can reduce the size of our fat cells that make extra estrogens for us. And by eating less foods that stimulate prostaglandins, such as things like processed oils and omega-6 fatty acids, processed meats, dairy products, we may also then see benefits. And in fact, there is an interesting study, which is a crossover study, that showed this very well. They did 2 months of a healthy plant-based diet, which reduced the intensity of period pain and the duration of pain as well. So I know that many of you will have people in your life that suffer from period pains who would really want to know this information. The researchers also found that increased sex hormone binding globulin, or SHBG, occurred in the bloodstream, which is really interesting. So the plant-based eaters had more SHBG. Now, what this does is an important type of protein molecule that holds on to hormones and stores them until they're needed. And the reason why this is beneficial is because it reduces your excess hormone exposure. So for context, women who are overweight or who suffer from polycystic ovaries tend to have lower SHBG levels. And so it does have a really important role in regulating hormone expression, as well as obviously the dietary changes that can reduce the amount of excess hormones that we are exposed to. Now, the other interesting thing about this study is that the women also reported increased energy, better digestion, and better sleep. And when the ones who were in the food group were required to ditch their plant-based diet to switch over to the placebo pill supplement group, many women actually refused, despite the conditions of the study, because they wanted to stick to the way of eating that had helped them so much. So I think that was a really interesting finding. Is there anything else that we can do to help with period pains? Well, interestingly, vitamin D. There are actually vitamin D receptors in our wombs. And a double-blind, placebo-controlled trial with a single high-dose vitamin D treatment was shown to reduce period pain. And this is thought to be because vitamin D reduces prostaglandins, which is what I mentioned is made by those endometrial cells, those womb lining cells. So that's an interesting one to keep in mind. I generally recommend vitamin D supplements, whatever your dietary pattern, and especially if you have an indoor lifestyle, and especially if you live in the Northern Hemisphere like I do. Ginger. Now, ginger has been shown in one study to be equally as effective as 2 different types of anti-inflammatory painkiller. So in one trial, there was 250 milligrams of ginger powder 4 times a day for 3 days. And that was as effective for pain relief for period pains as 250 milligrams of mefenamic acid, which is a common anti-inflammatory pain reliever, for 3 times a day. And also as effective as 400 milligrams of ibuprofen 3 times a day, which is another anti-inflammatory pain relieving drug. Lastly, curcumin from turmeric was also shown to have a potential benefit. Now, the polyphenols are thought to increase BDNF levels, brain-derived neurotropic factor. which improves your period pains, but also is known to help neurons survive and grow, neurons in our brain. A randomized controlled trial used curcumin 2 capsules daily from 7 days before the period versus a placebo pill. And the women did this for 3 period cycles. And they found improved mood, reduced pain, and also, as I mentioned, increased BDNF levels. So I would definitely recommend giving turmeric, ginger, and vitamin D a try if you suffer from heavy periods. So also, I want to touch again on the pill, because that's something that many of you will have tried over the years, and many of you will be familiar with, but perhaps some of you would have questions about. I do think that the oral contraceptive pill has been a lifeline for many women over the years to externally regulate their cycle and also minimize the effects of period pain in order to plan their families. Now, what happens with these is that combined oral contraceptives temporarily suspend the normal symphony between your hypothalamus, which is in your brain, your pituitary gland, which is at the base of the brain, and your ovaries, which are connected to your womb, by essentially drafting in an external band of players, which is essentially estrogen and progesterone that you're given in a pill form rather than producing yourself. So this can improve your period pains a lot, as I mentioned, and it also has the bonus of providing a reliable contraceptive, which can reduce the risk of ovarian cancer, also reduce the risk of uterine cancer, and it reduces the risk of colorectal cancer. But there are also other effects too that it's worth being aware of. So for some women, it can increase the risk of elevated blood pressure. It can cause migraines in some women. It can be associated with gallstones, reduced libido, blood clotting, particularly if a woman is over the age of 35 or a smoker, or she is overweight, or if she has a high blood pressure, which is why it's important to be monitored by your own family physician if you take the oral contraceptive pill. Interestingly, it can also cause potentially increased intestinal permeability and a small amount of nutrient depletion, which many women don't realize. And it can also reduce thyroid hormone usage in the body by increasing thyroid globulin. So in some women, it's great because it relieves cyclical mood swings, but in others, it could potentially amplify anxiety or low mood. In some women, it can improve acne, whereas in others, it can make it worse depending on the formulation that you choose. So you see, external regulation of hormones can have profound effects on the body, some positive and some negative. So what I would say is that one size doesn't fit all, and it really is worth discussing the pros and cons with your own doctor.